Good morning, good morning, good morning. Thank you all for joining us today. I am Laquita Mondley, and this morning I'm coming to you live with another special broadcast. In light of the COVID-19 situation, I know you guys may feel like you're being inundated with lots of useless information or lots of repetitive information. And to a certain extent, that's probably true. But I can say this, that many people are doing their lives, they're doing videos, they're doing special presentations across social media as a whole, because the awareness of the severity of COVID-19, that needs to be something that is pushed into the hearts and mind of people across the globe, because COVID-19 is something that is having a global impact right now on not just our nation, but on the world community at large. And what the reason that I'm coming to you today, and as I have across the last couple of weeks, is just to be able to do my part as a community leader, as a business owner, as a parent, as a wife, just to spread the information about the necessity of preventative measures across the globe. Many countries are putting in what they feel are necessary preventative measures to slow down or stop the spread of COVID-19. And we're doing that here in Texas. In Killeen, we have a shelter in place order right now. Many schools across the country and now across the world, school closures have taken place. Many employers are scrambling right now to find a way to allow their employees to work from home. And on the unfortunate side of that, some employers are unable to give their employees the benefit of working from home. But as many of you know, I am the co-founder of Mondley Innovations, and we are a work from home call center company. So all of my employees were already enjoying that benefit of working from home. And now on a greater scale, they realize the benefit of that because they are able to shelter in place, earn money, and be present and available for their families. But today, my special guest is my very good friend, Lauren. Lauren is an RN there in the great state of Florida, and she's going to be sharing with us even more information. And for some of you, it may be repetitive. And I do apologize if it's repetitive, but to hear a thing twice is not grievous, says the Lord, but sometimes it is necessary to be able to hear things more than once. Amen. And this is something that she's going to share with you. Like I said, it might not be new information, but maybe she can give it to us in a way that's easier for some people to process, easier for you to understand, and just, to put your mind at ease about the simple preventative measures that are in place. Lauren, how are you this morning?
I'm doing well. As you can see, we are home. The children are here. Happy homeschool day. We are going to make it, parents.
Absolutely.
All that good stuff.
Absolutely. I know homeschooling may be new for some. It's not new for all. On some of our previous broadcasts, I mentioned that, homeschooling your children can be a very positive thing right now, putting parents back in a primary position of influence in their children's lives, in every aspect of their children's lives. And because we have so many educators that aren't at school, in our communities, through our churches and various organizations, we just have to be able to come together as a community and be able to help each other, encourage each other, and provide resources so that we can properly equip our children with the education that they need during this time of school closure.
Yes. And like I said, we'll talk about that on another broadcast on my career choices, and having that ability to do so is awesome. Apologize, the boys are not getting along right now. Okay. But yes, going back to what you were saying as far as repetitive information, I kind of like to pose it this way. It's kind of like the seatbelt message. When you permeate a society with repetitive information, they're more than likely to repeat it. They're more than likely to do to go by it. Now, buckling your seatbelt now is almost second nature. When before, I'll say before my time, who wore seatbelts? Public health did a great job as in that example of making sure that this next generation, it's secondary to buckle that seatbelt. So kind of with COVID-19 and everything going around, and with all that, these preventative measures are important because it not only keeps you safe, it keeps your loved ones safe. And as a healthcare provider that's kind of on the front lines here, it helps keep us safe and us to have the ability to do our job a little bit better.
Awesome. I do know, like you said, you're there. You have two young boys. You are an RN, so you definitely are on the front line. Your job is to be able to provide the health care that people need that are positive with COVID-19, as well as those that aren't positive with COVID-19. And right now, people obeying those restrictions that have been put in place to help prevent the spread of COVID-19, it enables our first responders and those frontline people, such as yourself, to be able to be healthy and whole for their families. You go out to work every day to work your shift to be able to provide health care, but you also want to be able to come home and be healthy for your family as well. So yeah, we absolutely understand that. So, right now, like I said, our town is experiencing a shelter in place across the nation. Many places are experiencing a shelter in place. Businesses are closing that aren't deemed necessary. Can you talk to us a little bit about, why social distancing is important? Why are these school closures important? Why is it important right now more than ever for companies to be allowing their people to work from home?
Yes. So social distancing, there's a difference between social distancing and social isolation. I know it feels like you are being left alone and you are not. I apologize. I apologize for the kids are here.
It's school closure, right?
Isolation and social distancing. Stop it, please. You're being disrespectful. Please stop, gentlemen. Thank you. There's a difference between the two, and it's important to keep the distance because there is a little graphic. I like pictures when talking about something, and there is a difference between distancing and isolation. Distancing is avoiding big crowds, avoiding being within 6 feet of someone, and it's because the information is always changing on how COVID-19 is spreading, but right now, it's, from what my understanding is, it's being spread mostly droplet at this point. So if you're infected, if you look at the picture, if you are the one person that has it, within 5 days, you're going to infect someone else. Please stop. You're going to infect another few people, and then over time, the next 30 days, look at how many people that you've infected. The next is if you lessen your exposure, you're over 30 days infecting a less amount of people. And then if you limit your exposure by 75%, look, you have decreased the spread by over half. And what that does for one, people, and two, healthcare in general, is we lessen that bell curve of the heightening the peak of exposure. Our healthcare system can't handle a mass influx of disease. One, we don't have enough ventilators. We're running out of supplies. You hear that over and over, not having enough masks and all of these things. So it's really important. And I would almost consider it your societal duty, just as it is important to vote, it's important to kind of help your neighbors stay safe.
Right.
This is affecting, the elderly population and those that are immunocompromised, meaning those with already diseases like heart disease, diabetes, autoimmune diseases, things like that. Asthma, any respiratory, COPD, emphysema, all of those people that already have healthcare complications are having a difficult time. And as you can see, the death toll has been rising, are really being impacted from COVID-19. So it's almost like, let's keep our grandma safe. Let's keep our family members safe from this. Stop, guys, please. Sorry. I'm talking and parenting. Okay, you need to.
That's okay, because I'm looking at the graphic there that you provided, and behind social distancing, and it just makes sense, if what people are telling you verbally isn't connecting the dots, then preferably what this graphic will be able to do is, in the top graphic, one person can affect 2.5 people, within 5 days. And then those 2.5 people within 30 days can infect 406 people.
Yes.
So when we lessen our exposure to people, one person in a 5-day period can affect possibly 1.5 persons. And that 1.5 persons could only infect 15 people. But then when we lessen that exposure again, that takes us down to less than half a person being infected, which will take us down within a 30-day period to 2.5 people being infected. So something as simple as social distancing, being in that shelter in place where we're limiting our movements in and around the community, we're lessening our likelihood of becoming that person that was infected, as well as during that period when you're unaware that you have the virus and you're unknowingly infecting other people. This is something that's malicious. If you have the virus and you don't know you have it, so you're going to continue about your day as normal, and you're unknowingly spreading that virus to other people. So, I thank you again for providing this graphic and providing your wisdom and insight into why these things are so necessary, because this virus doesn't have, there's no disqualifiers.
Right.
Absolutely. It doesn't disqualify. I think we were talking on the phone earlier, and the late breaking news earlier in the day was, Prince Charles is now, COVID-19. So it doesn't matter your social standing, your ethnic background, your religious belief, male, female, rich, poor, young, old. This virus is impacting many people across the world. So, like you said, I believe it's our social duty to be able to do the things that we can do, that we do have control over, in order to help limit the spread of this disease. And what you were saying there in the beginning about our health system just is not capable of handling something on that level. I'm from a really small town in Mississippi, and I was thinking about, what are the resources that the people in my hometown of Macomb, we have a hospital there and it does the best that it can do. But though we are a small town, that one hospital and the many, doctors' offices and clinics that are attached to that hospital within that Pike County area, and there, there's one hospital in the city of Macomb, and then there are other local hospitals in some cities surrounding it. But just thinking about that, my friends, my family, my loved ones there in that city, if more than 200-300, if more than 200 people, probably, I'm sure some health providers in Macomb will jump in and correct me on that at any time. They can't handle an infection like that. They can't handle a massive influx of patients like that, no matter how great their intentions are. So whether we're in big cities, small town America, rural America, we have to be able to do this to help the healthcare providers out by limiting the number of infected people that they have to take care of.
Right. That's ultimately, I believe, the message that's going across. There's not a one way fixes all. I mean, as we're learning on the news every day, that we're learning more about COVID-19 as I would even say as the hours progress. And what the CDC, Mayo Clinic, the message being spread right now is stay home. Do your best to stay home, avoiding those big crowds. It's important to, like, preventative measures, wash your hands with soap and water or hand sanitizer. With the hand sanitizer, making sure that it's at least the 60% alcohol on it, so that way it kills germs. Just practicing good hygiene in that regard. Avoid touching your face. I know that they're saying for the CDC is recommending for people that don't have any symptoms, and we'll talk about symptoms in a minute, that people that don't have any symptoms, you don't need to wear a mask in a sense, but I know that there's other things that are saying if you wear a mask, it's kind of that reminder to not touch your face. But if you can kind of remember to keep your hands clean, away from your face, because that's where the virus is transmitted when you're breathing it in. If it's going into your lungs, in a sense, your eyes, all of those open areas are sources where those droplets can enter, and you can become infected by the coronavirus. When you're coughing, I know that this has been practiced, cough in your elbow, in your sleeve. My kids are pretty good about that now. We've practiced that for a little while, but or in a tissue, and then soon after, go wash your hands. And if you have the ability to change your shirt, because that's now in your sleeve. What that does is when you're coughing or sneezing in your sleeve, it prevents those particles from transmitting in the air. So you've limited the spread of your sneeze or those droplets in the air by doing that. Cleaning your house, keeping things disinfected. I know we're running on a shortage of disinfecting and cleaning materials, but stuff like, if you can remember, wiping off your counter surfaces, anything that you really touch, your doorknobs, your light bulb switches, the faucet, things like that you're always touching, handrails if you're going up the stairs, your banisters, your telephones, cell phones, anything that's going to come in contact with your face or that you're readily using. I know that for me, like coming from work, I completely changed my clothes in a sense before I even step in the house. They go in a plastic bag. I have hand sanitizer that's right at the door of my car. And that way I'm trying to prevent from bringing things into my house. My shoes stay in like a little plastic container in the trunk. I wipe them down with the little wipes before I leave work in a sense. And then I have a change of shoes that are sitting right at the driver's seat waiting for me. And then I get home and they go straight to the wash, and I go straight to the shower before I look at anybody, touch anybody, hug anybody, that sort of thing. And I do my best to keep masks and stuff. If I feel thank God I haven't felt any symptoms or anything, but they're saying that you can spread this even if you don't have symptoms. So that's why the social distancing is important. I know you say, oh, I feel fine. I can go to the store. I can go do this or that. I'm going to keep about my daily life. But this disease is taking 2 to 14 days sometimes before you feel those symptoms. A cough, a fever, trouble breathing, or shortness of breath. Some people might, I just feel a little winded. I should walk up the stairs a little slower, or things like that, where you kind of like write them off. But it's important to kind of take those things seriously now, because they are, in a sense, general symptoms that we're experiencing. Oh, it's just a cough. It'll go away. It's just some sneezing. It's just, I just have a slight fever. I'll take some Tylenol. All of those things mean, hey, I'm symptomatic. And at that point, that's where this isolation, in a sense, comes into play. So isolation is separating yourself. If you have a family, trying to keep yourself in one room away from everyone else, not sharing dishes. All of that should already be not sharing. We shouldn't be sharing water bottles or sharing forks or things like that, but keeping yourself in a separate room, away from everyone else that you can expose this to. And at that point, wearing a mask to try to mitigate all of that would be important at that point if you're feeling symptomatic. And all of those things will help prevent and help decrease the spread of COVID. And then that gives science and research a chance to really, it'll help decrease the mortality rate. And it gives us a chance to look for vaccines and research for preventative measures, learn more about what's going on with COVID. I know research is out there. Harvard Medical School has something coming out daily. Johns Hopkins, all of them are working extremely hard to provide information and resources available. And I would throw a little caveat on some of the symptoms of when you should come to the emergency room and when you should stay home. It really is safer if you're having mild symptoms where you can manage it at home. We call it symptom management. If you're tired, other symptoms are tired, if you're aching, all of that, all of those things, stay home, take it sleep. If Tylenol helps, wonderful. Drink some tea. If you're able to manage it, kind of like you manage a cold, a common cold, if your symptoms aren't getting to the point where you are persistently short of breath, you're not having that or chest pain or pressure on your chest, confusion, irritability, if it's symptoms like, hey, I really need help, then yes, by all means, we are here. Come to the emergency room, come get treatment. But if you're able to manage it at home, call your family physician first, and they'll let you know, hey, should I come in? Should I stay home? Call your primary care providers. That's what they're there for, in a sense. And emergency treatment is emergency treatment. But we're trying to mitigate those that are coming into the hospital that truly need it. Those patients that have to be intubated and need those extreme measures to get healthy, to stay alive, in a sense. But if you're able to manage things at home, it's safer for you, honestly, and it's safer for everybody else if we can just kind of love each other from a distance, I like to say. Technology.
That's some great information there. If you can self-manage it, continue to self-manage it, and basically, because it's globally known that the world health community at large was not prepared for this situation. And as many healthcare professionals around the globe that are working tirelessly day and night to come up with a cure and to provide, what's necessary, to provide the mask, to provide the gloves, to provide the beds, to provide the ventilators, to provide all of the health equipment that's needed to properly provide care to people who are suffering with this and that are having life-threatening things taking place where they need the ventilators and such. If you can self-manage, like Lauren said, call your healthcare providers, let them give you that assessment over the phone or virtually via teleconference. Let them do their job in that respect so that you won't unnecessarily put yourself at risk, as well as that it will be room for those people who actually need to be hospitalized.
Yes.
Awesome.
So 2 ways: wash your hands. Try and stay home if you can. Limit your groupings to 10 or less at this point, I believe some of the states are saying. And just do your best to stay healthy. Keep your hands out of your face. Keep your kids healthy. Keep your family healthy.
Awesome. We have some questions, actually. So there was a question earlier about, the age, because we mentioned that this thing doesn't have an age. And so I know that people get a lot of misinformation, erroneous information. Does this COVID-19 have an age demographic attached to it?
It doesn't. I think research is showing that it's affecting, they were saying the young and teenagers, college students, the young adults, mostly healthy people the myth was they're not being affected, but the truth is they are. It affects children. It affects young people. I believe I saw something yesterday or the day before. There was a nurse in Missouri passed away from this. So she was probably 30s, 40s. I'm not sure. I don't remember the exact age, but it does affect everyone. There's a lower percentage. The research that's coming out of China that children are being affected, but it's at a lower level, but it still is affecting children. So yes. And like, for instance, for me, I've got an 8-year-old and a 5-year-old, but my 8-year-old he'll be 8 in 2 days. So I'm just going to call him 8. He has asthma. So for us, he's already at a higher risk because he's compromised in that area. So I've been trying my best, in a sense, to keep them healthy at a distance. When I work, I don't have them come home, in a sense. They're with grandma and everyone. I try to keep my distance as much as possible, but them being young, it's like they're not quite understanding. And I know that's that struggle many of us are having.
I have it. David's 17. He'll be 18 in April. And, those that follow me on social media know that David is an active child and he keeps his mom and dad quite active. So, he's football, he's basketball, he's track. He loves to get in the gym and work out. And his inability to do those things right now are driving him bananas. I should start a new Instagram story, the sagas of David and being, in quarantine. It might be funny to somebody, but it's not always funny to me and his dad. But because this thing is not, has no respect of person. So we want to be able to keep everyone as safe as possible by limiting our contact with other people and limiting our movements in and around our city and our community to only those things that are absolutely less necessary. We have my daughter, as is pregnant, and so she's 7 months. The last thing we want to do is unintentionally bringing COVID-19 in the house, and she's pregnant. And my granddaughter needs to stay right there until her due date. She didn't need to come early simply because we were bored and we couldn't manage staying inside. So let's do what we've been asked to do. This too shall pass. It's truly not the end of the world. There are silver linings in every cloud, as they say. We have to be able to look at this from a positive standpoint. Okay, what can I do during this time to improve myself? How can I bring a greater level of unity in our families? How can we, make the best out of this situation while keeping ourselves safe? And helping Say that again.
I said it's our civil duty in a sense.
Yes,
absolutely. To do our part.
Yeah, absolutely. Absolutely. Well, Lauren, thank you so much for spending this time with us today. Tell the boys hi. Thank you for the cameos. Like the kids are home.
Yes.
Kids are home. This is a real thing that we all have to deal with. If David if he was not asleep right now, he would probably be yelling, "Mom, I'm hungry." You know. So we have
experience. They just had a little argument. They're both 5 and 8, like I said. There,
it's what children do, but we can still, as adults, we have to learn how to manage and function, and still allow our children to be children as much as possible. Because normally they'd be at school right now having fun with their friends.
Yep.
Probably at recess or something like that. David would have been wrapping up his sports PE right now and burning off that energy. So I like to be as real and authentic as possible. It is what it is, people. We still have to do our part. We still have to, if we are able to work from home, we still have to work from home, but while balancing that out with being able to be present and available for our children. So, until next time, I'm Laquita Monley. My special guest, Miss Lauren, thank you so much. I'll be coming to you again on tomorrow with more great information on what we need to do while we're waiting during this COVID-19 crisis, as well as offering tips and advice on how to be successful with working from home. I'm Laquita Monley, the co-founder of Monley Innovations. And until next time, you guys have a great day.
Mom, you're funny. You said